For more on this now, I'm joined by Child Protection Thematic Program Manager at Save the Children South Africa, Margaret Zulu. Margaret, thanks for your time this evening. What are your initial thoughts on the launch of the Child Poverty and Child Support Grant Review Report, and how do you view its significance for children in South Africa?
Yes, it's very significant, and thank you so much for having us. Let me start by introducing Save the Children South Africa. I know we are known, but it's important to remind the viewers that our vision really is to see a world in which children attain the right to survival, protection, development, and participation. And for us to be able to see them surviving, learning, and being protected, we know that we need them to be poverty-free. And so we welcome the report, and we welcome the conversations around the effects of poverty on children, but also how critical the granting system is for the betterment and wellness of children, especially to the development and other areas related to that, including education.
Now, the report highlights the success of the child support grant in reaching a large number of poor children. Could you elaborate on the positive impact that the CSG has had on child poverty in South Africa? Yes.
So perhaps let's start with the issue of poverty and what it does to children. We are aware that according to Stats SA, in 2017, about 2021, about 207 children were married off. So we should be asking ourselves, why are children getting married early? That is one effect of poverty. Another effect of poverty is the issue of sexual and gender-based violence. Child marriage itself is an indicator of sexual and gender-based violence. We are looking at issues of nutrition, issues of low levels of education for the children in terms of dropout rates. We are also looking at the issues of HIV infections, and according to UNICEF data, we are alarmed to know that by 2030, if these trends that are going on, including child poverty, if we do not do much about it, the new infections will increase by a wide margin. And therefore, for us, this report is really critical. And our view really is that we are grateful that there is the grants for the children. We also acknowledge the fact that Department of Social Development is reviewing the grant, but we know that a lot can still be done, and it can be improved, and we support all the efforts that are working towards improving the betterment of the lives of children in South Africa.
Margaret, when Social Development Minister Lindiwe Zulu spoke in that clip that we saw a little while ago, she talked about how much work and effort women are putting in raising children and having to deal with the challenges of poverty. Where are the men in this conversation?
The men are in the conversation. I'm happy to report that in our community interventions in South Africa, we engage with men, and as you may be aware, we are also engaging the boy child to find out from the children themselves what is it that they need, how can they be supported. So the boys and the men are included. And we've had support from a number of organizations that actually also work with men, include men in their responses. So I should mention that on the ground, in the communities, we are having conversations with men. It's not just at a higher level. But when you ask to say where are the men, especially in the home, that is why we are engaging not only with duty bearers to ensure that conversations with men are fruitful, but also in the communities we are continuing to engage with men as well to ensure that we do not leave anyone behind in this conversation, and especially boys, so that the responses are also targeted at the boy child as well.
So when we look at the development of a child who's comes from a background of poverty and that is going through these immense struggles that we talk about or imagine, what sort of development do they go through versus a child who's raised in a family where there is no poverty?
You know, it's important for us to think of a child, not only the born child, but we look at the whole cycle from the time this child is conceived. What is the nutrition of the mother? What are the conditions that the mother is going through, is exposed to as they are, as they are pregnant with this child? What happens then when the child is born? And so these exposures have a significant impact on the lives, not only of the unborn child, but also on the children that are already with us. And some of the critical indicators of that, as you mentioned, is on how we see their issues of mental health because of the trauma that comes with poverty. The child is then forced to work instead of being in school. The girl child is forced to stay at home when she's having her menstrual periods because she just does not have the menstrual, sanitary wear to be able to wear and go to school. So there are intricacies and a lot of complexities around this. And what we know and we have seen in the communities where we work is that the children that are not exposed to poverty are in school. They are thriving. But what is happening to a child in the rural areas, the hard-to-reach areas, as much as services are being, rendered, but does the child have access to that service? So what we are seeing, and you will be aware that there's mental health issues, including depression, anxiety, some of them also resulting in suicide. There's issues of child labor. There's issues of sexual and gender-based violence where now sometimes even, unfortunately, guardians are involved in marrying the child away because they are unable to fend for the children. But also a lot of violence within families because some of this violence would even emanate from the fact that there's just no food to eat. And so there are a number of issues that I could allude to, but definitely there is a difference between a child that has been exposed to poverty and a child that has access to different services.
Margaret Zulu is the Child Protection Thematic Program Manager at Save the Children South Africa. Appreciate your time.